Almost every black woman that I know over the age of 40 has fibroids. Most of y'all don't even really know what it is, except that your mama had them and then she had surgery and now she doesn't have them. Well, I'm going to let you know what the real deal is. Uterine fibroids are non-cancerous tumors that develop in the uterus, and they're very common. As many as 1 in 5 women may have fibroids during their childbearing years, and half of all women have fibroids by the age of 50. Fibroids are rare in the women under the age of 20, and they are more common in African Americans than in Caucasians. We don't know the cause, but they have been linked to the hormone estrogen. As long as a woman with fibroids has a period, a fibroid will probably continue to grow, usually very slowly, and they can grow very large, sometimes upwards of 8 pounds. That's like a baby. Although it is possible for just one fibroid to develop, usually there are more than one. So what are the symptoms? Well, bleeding between periods is a common symptom, as well as pelvic pain with heavy menstrual bleeding, menstrual periods that may last longer than normal, urinary frequency, and a sensation of fullness or pressure in the lower abdomen. I find that when you start getting that little pooch belly, but you're not actually eating too much, this is a common symptom of fibroids. Also, pain during sex could alert you to these tumors. But sometimes there are no symptoms at all. That's why you got to get your butt up and go to the doctor every year. It can be difficult to diagnose fibroids, especially if you are extremely overweight. An ultrasound may be done to confirm the diagnosis of fibroids. Sometimes a pelvic MRI is done. A biopsy of the uterine lining or laparoscopy may be needed to rule out cancer. Treatment for fibroids depends on your age, general health, severity of symptoms, whether you're pregnant, and if you want to have children in the future. Some women may just need pelvic exams or ultrasounds every once in a while to monitor the fibroid's growth. So how do you fix this fibroid problem? Well, you can use birth control pills to help control heavy periods, or you can get an intrauterine device, or IUD, that releases the hormone progestin to help reduce heavy bleeding and pain. You can take iron supplements to prevent or treat anemia due to heavy periods, or take medicines such as ibuprofen for cramps or pain. Sometimes you can get hormonal therapy injections to help shrink the fibroids. Many times you have to have surgery, and that will be up to you and your doctor to decide. You can get a hysterectomy or a myomectomy or many other modalities, but you gotta address the issue. If you get pregnant while you have large fibroids, it could compromise the pregnancy, so please get this looked at immediately. The odds of fibroids being cancerous are very rare, but it is possible. The bottom line, if you have these symptoms, don't wait because you're scared. The longer you wait, the worse it can be. Make sure you check out our Health A to Z section of the website for more information. I'm your favorite doctor, Dr. Corey Hebert for BlackHealthTV.com.